Hi Natalie. Today we're going to do some tests to assess the function and range of motion of your upper cervical spine and your jaw.
Okay.
So right now I just want you to sit like you normally would, and I'm going to assess your posture, looking for asymmetries in the front view, in the side view, and the posterior view. So I think everything looks pretty good. Now I'm going to test the range of motion at your OA joint. So what I want you to do is to nod gently like you're bringing your chin into your Adam's apple, or like you're making a double chin. And I'll be assessing you from the side. So can you just nod gently? Okay, looks good. So now I'm going to test your rotation at your AA joint.
Okay.
So what I want you to do is to take your right ear and place it as far down to your right shoulder as you possibly can. And now look over your shoulder. That looks good. And can you do the same thing with the other ear? That looks good. So now what I want you to do is to open your mouth and close your mouth. Can you tell me how many fingertips you can fit in your mouth? About 4? Okay, can you bring your jaw from side to side for me? And can you bring your jaw forward for me? And can you bring your jaw back for me? Okay, that looks pretty good. So now what I'd like to do is come behind you and palpate your jaw and your muscles of mastication. So I'll find your acoustic meatus, and can you open your jaw for me? Okay, fantastic. One more time. And can you open your jaw for me? That's good. And can you open your jaw for me? That's good. Okay, so now I'm going to do a sharp pursure test, which assesses the stability of your transverse ligament. So what I'm going to do is come behind you and find your spinous process of C2. And then I'm going to take you into away flexion. And then I'm going to apply posterior pressure. Okay, seems good. So now I'm going to do a tectorial membrane test. So I'm going to come behind you and apply posterior pressure on your shoulders, and then give you a little bit of light traction upward, and then nod you. And once more. Okay, Natalie, so now we're going to do some passive tests with you in supine. The first one I want to do is a passive check of your OA flexion. So what I'm going to do is just take you and then nod your head at the OA joint. And add a little bias with my left hand, add a little bias with my right hand. So now I'm going to check your range of motion at your AA joint. It's going to take you in a side bending, add some pressure. Okay, so now I'm going to do a test of your alar ligament. So what I'm going to do is find the C2 spinous process, feel it in between my pinch grip, rotate your head to one side, rotate your head to the other side, feeling the spinous process. And then I'm going to put you into lateral flexion on one side and lateral flexion on the other side, feeling the spinous process. So now I'm going to perform a transverse cruciate ligament test. So I'm going to find the transverse processes of C1, and I'm going to apply upward pressure. And I'm going to look in your eyes to see any signs of spinal cord compression. And if I don't say any after 15 to 20 seconds, we'll pass you. Looks good. Okay, so now I'm going to test your spinal coupling. So I'm going to take you into OA flexion and then bring you into lateral flexion. And I'm going to do the same on the other side. Bring you into some OA flexion and then some lateral flexion. And I'm going to test the OA extension with combined lateral flexion. So I'm going to extend you at the OA joint and take you in some lateral flexion on one side. Good. And then I'm going to take you into some more OA extension and lateral flexion on the other side. And the whole time I'm feeling where your occipital condyles are. Okay, that's good.